Let me talk for a moment now about Senate Bill 311, which is pending in the state legislature. And I know that all bills are well-intended. I know this bill is well-intended, but I think there's some things that maybe the legislators don't know, have not looked at, and things that I think are very, very important. The bill, if enacted, would severely limit the ability of the Department of Health to issue orders necessary to prevent the spread of infectious diseases. Not just this one, but ones in the future. That's very, very important, because when we legislate not just for today, not just for this governor, but for someone else and other times and other circumstances. Legislation would remove the authority that's required to deal with other outbreaks in the future. A couple examples. If a person, let's say in the future, if a person comes to Ohio from a country that is suffering from Ebola outbreak, a future leader of Ohio would not be able to ask them to quarantine until it's certain they were not directly exposed to a carrier of the disease. So you couldn't just say, if you're coming from that country, we know that's a huge problem. You're coming into Ohio. We really need you to quarantine. What this bill would say is you can't do that anymore, Health Department. You cannot order that. You've got to go find out directly, was this person exposed? This would be devastating. These people would be free to shop in our stores. They would be free to eat in our restaurants. They'd be free to go any place in the state of Ohio, possibly spreading a deadly disease to unknowing Ohioans. Not good. Another example, earlier this year, President Trump very correctly placed a moratorium on travelers from Wuhan, China, in order to slow the spread of COVID-19 to the United States. There's no question that this brought the states some valuable time. It gave us some valuable time. Didn't stop it from coming, but it gave us and bought us some time. But if in another crisis, a future president didn't take action like that, and it would be up to a governor to do, Ohio would not be able to impose its own quarantine on those coming into Ohio from a hotspot, and therefore we would be unable to protect our citizens. So if that had happened and the president had not done what he did, and it would have been up to us to do it, I would not have had the power, or no future governor would have had the power to do that. That can't happen. Worse yet, imagine a day when a country hostile to the United States smuggles a biological agent into our state and unleashes it on one of our military bases, let's say maybe Wright-Patterson Air Force Base. Our state would need to respond quickly to quarantine the area to stop its spread. Yet this bill would not allow us to do that. In national security matters like this, time is of the essence. We would have to act immediately. As governor, I would not have the ability to do that if this bill becomes law. This bill would make Ohio slow to respond to a crisis. It would take tools away from this governor or future governors. It would put the lives of Ohioans in jeopardy. This bill is a disaster. And again, never in any way do I impugn the motives of members of the General Assembly who have written this. I know it's well-intended. They intend well. But when you really look at the ramifications of this bill, this is not a bill that, can become law. I have said throughout this pandemic that I would take advice and have been taking advice from medical and health experts. Health experts have told me that this bill should not become law. They have told me that this bill would be a disaster. Doctors, nurses, scientists have all advised me about this bill. For that reason, if by chance it would pass, I would veto the bill. because I would have a moral obligation to do so. We cannot subject Ohioans to these possibilities. I want to read from excerpt from retired Army National Guard Colonel Paul McAllister's testimony. I believe this was written testimony. My experience during exercises and real-world events, the ability to shelter in place or to evacuate an area that has been affected by CBR any event is critical. It is a matter of life and death. It is a matter of life and death for possibly hundreds of thousands of Ohio citizens. On July 11, 2012, 17 train cars derailed within the city limits of Columbus, Ohio. They carried ethanol and caused a large fire. Imagine if that had been a deadly chemical, and the plume that rose from the fire contaminated a large region of Columbus and its surrounding counties. The governor and director of the Department of Health would have had to immediately issue shelter-in-place orders for the areas where it was not safe to go outside and evacuation orders for the areas that were in the path of the deadly plume. I believe this bill would affect our ability to respond as a state. Further, quotes, there are multiple scenarios, either man-made or natural disasters, that would require the governor and director of health to have to do immediate and long-term orders in order to save lives, reduce human suffering, and to eventually restore our way of life. I believe that this bill would be detrimental to our ability to respond any large-scale event in the state of Ohio in the future. I have also testimony from Andy Thomas, testimony from others that I'm not going to read because of time. I may get to those in the future. But we are running out of time, and so I'm going to move on.